Hey, welcome to Tennis 2020, Real Talk, Real People, Real Life. And today we are talking with Dr. Danielle Grant of Beansprout Pediatrics. And Dr. Grant has in the unique position of being both a pediatrician and having a couple of young boys who play pretty serious tennis and train on a regular basis. So welcome, doctor. How are you?
Thank you. I'm great. Thanks for chatting with me.
Yeah, interesting times, and I we started out this whole COVID-19 discussion with it was a disease which was going to affect old people in a very serious way, but maybe young people not quite as much. But that doesn't seem to be the case anymore. And what I hope is maybe we can have a real discussion and get some myths out of the way while we're here.
Sure thing. Yeah, it's definitely been a changing conversation over the past couple of months. Where when the illness first affected China, we really didn't know a whole lot about it, and the fact that it's hitting us a little bit later, we've been able to learn a little bit more about the virus, about the numbers behind it, and it's definitely a changing entity and conversation.
So have you seen what's it look like in Austin area right at the moment in terms of
Yeah,
have there
it's,
been any
it's interesting. So yeah, I check the numbers pretty much every day, maybe a couple times a day. And they're updated by the Austin Health Department. And luckily, the cases in Texas compared to the rest of the country and the rest of the world have been pretty low. But that number keeps changing, and that's the scary part. So right around the week after spring break, when we all really started to understand the shelter in place and stay at home and social distancing, the numbers were in our area in Travis County were you could count them on one hand. And now, as of today, I think we're up towards 206 cases in Travis
wow.
County. And with the increase in cases, becomes an increase in mortality as well. Overall, compared to New York, California, the rest of the world, these numbers seem pretty low right now. But my hope is that maybe we started social distancing a little bit on the early side where the numbers were low when we started social distancing,
Hmm.
where maybe some of these other parts of the country didn't have that opportunity. Or is it just a matter of time? And I think that's the thing I struggle with every day, and the fear that I have every day. Um, I do think we live in an amazing community where I think everyone is really taking this very seriously, and very seriously from an early standpoint. We saw that with Austin Tennis Academy early on, where they really put some good things into place, and now have had to adapt with more just social distancing tennis, if you will, through video and virtual interactions, which I'm glad that they have. And we've had to do that from a pediatric standpoint as well. And I'm sure a lot of the other small businesses in the area that deal with kid activities. So that's probably been the biggest change, is really just this adaptation that we've had to do on a day-to-day basis.
So I guess we're what, a week and a half in Austin, Travis County of being in a stay-at-home order, but right outside of here wasn't. And so there were other places, in a pretty close geographical area where that wasn't the case. So do you think there might be more community spread because of that? And do you think that the numbers going up are because the spread is actually happening, or is it there's just a lot more testing going on, so we're seeing a more accurate reflection of what's going on?
Right. I think you're seeing that you kind of hit on a couple points there where, some areas may not have practiced the social distancing early on, but then also, a lag time in one, being able to get tests, two, the amount of time it takes for a test to come back. But hopefully, if a patient or a person were having a pending test, then they would know to quarantine and also quarantine their families. So hopefully, good practices in place from an early point will keep us in a better position compared to some of our neighboring communities, and certainly different states around the country. That's my hope.
Good. Well, pediatricians are some of the most special people. I have two daughters who are out of high school and 18 or older, and they had to leave their pediatrician, and that was a pretty big moment for them. They loved Dr. G. That was he was the
Yeah.
man, and they had a hard time thinking, well, I have to trust my health to someone else. And I noticed, looking at some of your social media and the Facebook things, you're kind of the happy doc. You tend
I'm
to,
happy.
yeah,
Yeah.
yeah. Um,
It's easy to be happy. I love what I do. I think it's the perfect choice of a profession for me, and it's the perfect area to practice pediatrics too. So, cool part about our job is that we get to see these newborn babies grow into essentially adults.
mhm.
So I started the practice 10 years ago. So these newborns 10 years ago are now in fifth grade. It's an amazing transition. And then some of the older patients that I have are now in college. And I just talked to a couple patients yesterday that are home from college, and they're 19 to 20 years old, and they're still wanting to come to us for pediatric care, and we're trying to make that transition or help them make that transition. But it's a really cool feeling, and I think it's a unique part of medicine, and I'm happy to be a part of it.
Well, wait till another decade or so passes by. We have in the program at ATA a young man who's about Dane's age, who is the son of someone Coach Newman coached when he was in juniors. So when you
Wow.
start seeing when those kids become adults and they start having babies and they come looking to you to be
Right,
that
you have just this
pediatrician.
legacy of families, which is pretty neat. So
Yeah, it's exciting. Let's talk about your
Mhm.
boys' tennis for a minute.
Sure, yeah.
I mean, I know, but for those that are watching, how much do they play? How often do they play? Or were they playing?
They play every day during the week, whether it's through Academy at Austin Tennis Academy, playing with us for fun, playing with my husband for fun. It's truly a family sport and a lifelong sport, and that's what I think drew us to it in the first place. I was an athlete growing up, but I never touched a tennis racket until I moved here to Austin and just fell in love with it from the get go. So it's at the point now where the boys are truly beating me on the court, and I'm playing my heart out, and my knees are bothering me, and I'm proud of them. We get to play, doubles with each other. My daughter started playing out tennis with Coach Jaime at ATA, and she still talks
Ah,
so much about her, but has semi-retired. I'm hoping she comes back to it, but she fell in love with dance and gymnastics, so tennis is on pause for her, but we still try to get her out there with the family.
well, good for her. So and just, I guess I can share, Austin Tennis Academy made the decision when the shelter in place was happening that we were totally closing. Coach Newman made that decision that we would not be doing any kind of tennis lessons, individual or group, at Austin Tennis Academy. So the doors are closed, and that kind of shut the doors for the outdoor activity for the boys. At least that part of it,
Right,
because they were there almost every day. It
right.
seemed like. So how has that
They were.
changed? How has that changed? Right, because they're not getting
When, yeah, I mean,
playtime at
they're
school or.
home, right? Well, they're home, which is great in the sense that we have a lot of family time that maybe we wouldn't have every single day, with them going off to their activities in school. And if one thing for the staying at home and shelter in place, it really made me appreciate family dinners again. I mean, that was,
Mm,
always kind of rare, I think, for us because we're always on the run, running in different directions. We both work full time, my husband and I, so it was always kind of a grind. So to have the time to be able to do that is great. To even though they can't play tennis the ATA facility or with some of their peer group, which I think is just probably the most valuable thing to them. We're trying to pick that up at home a little bit. So we're playing tennis with each other. We have things set up in the garage and in the driveway, and we're able to get out a little bit and work on some things with them, which has been a lot of fun.
have they?
Challenging but fun.
Yeah. Have they been stressed at all, feeling like maybe they're losing ground, or how have
A
they
little
taken it?
bit. I think, yeah, I think that missing the tournaments. I mean, I think both boys are very tournament driven at this point in their tennis career, if you will.
Mhm.
So especially my oldest, he knows when the tournaments are, what city, what, always looks forward to the draw coming out. And I think that's probably the thing that he's missing a lot. And then, of course, just being around their buddies at ATA. They started with ATA pretty early, so they have this just amazing peer group that I think is irreplaceable. So I think that's the one thing that they're struggling with. The virtual tennis is it's something they look forward to every day, and today I think they have like a fun Friday Jeopardy and they're all over it. They're excited about it. So some of the things that you've had to put into place, I think it's been very creative and very necessary to keep them involved and driven. So I really appreciate that.
So let's talk about that tournament structure, and maybe if you can come at it from a physician point of view. Is How scary is this virus to you?
It's scary. The numbers are scary. The stories that you hear are scary. So a lot of people have said, what's is it? Are we blowing this out of proportion? Is this another flu? Well, the thing that I worry about is that the mortality rate seems to be higher. There's a lot of numbers thrown back and forth. It's really hard to sift through all the data, but you hear these stories of people getting sick pretty fast. Now, you mentioned the beginning of our conversation about the elderly being affected more, and that's definitely true, but it's a virus that I think doesn't discriminate. So there are going to be younger people that get affected. The thing that lets me sleep a little bit more easily at night is that children are faring pretty well with this virus. So from the numbers from China, Germany, all the kids have relatively stayed very well, even though they've had the virus and have had symptoms. But I think what I've learned from this virus more than anything is the importance of overall public health. It's just been from the beginning a very public health initiative to try to keep the numbers low so that we can keep people as safe as possible. So unfortunately, it's a very, I think, aggressive virus and a very virulent virus in the sense that if someone does get the virus, there's a potential that they can get very sick. And if you have a lot of people getting sick at the same time, then everybody is overwhelmed. And you were starting to see that with the numbers coming out of New York. And like I said from the beginning, I'm hoping that we do a good job with keeping our numbers as low as possible.
So your oldest plays at a level where he travels a little further, right? So he may play almost anywhere.
And Dane just kind of made that bump up recently too. So we're both, I think it's almost a little better now in the sense that they're both at that champ level, I think at different times in their careers, but certainly we're traveling around the state, which is good and bad, I think.
Right, so tennis tournaments are a pretty communal affair where when you see them, you see a lot of families where not just the child and a parent, but sometimes both parents and sometimes grandparents and siblings are all in tow. And if we're in a place where, kids are traveling from different places to one geographical area, is there, pretty significant risk of spread of a virus, since it's been reported that people can be asymptomatic and still be spreading the virus?
Exactly. And there might be higher numbers in certain areas of the state. So then all of a sudden you're bringing that risk to more of that local area where you are at that particular time. So I think, on a broader level, international travel and then domestic travel, and then now you're talking within the state. So I think that right now where we are with staying in place and staying with our families, that's the safest thing to do at this moment. And then hopefully after this virus peaks and starts to go down and we see less numbers by all the things that we're doing, and hopefully some medicines that can help, some development of vaccine, then we'll be in a different place, hopefully as soon as possible. But I wouldn't rush it. I wouldn't rush it, because then we'll just see more spread.
Right. I've become pretty focused on what will it look like as things start opening back up again. I think lots of people are giving advice of everybody just needs to shut it down as much as possibly can so that we can, make that curve a little bit more shallow and spread out so we don't overwhelm the healthcare system. And now I'm like, okay, well, what will it look like as we start coming back? I had a coach in Spain tell me earlier this week, his prediction is there will be no international competition for the rest of 2020 because of various hotspots around the world and getting people on planes and getting people together in stadiums, and that probably won't happen the rest of this year.
Right.
Wondering, how much are the boys going to miss competition? I know it's real early, and every day it seems like it's changing. You, as a healthcare professional and a parent, what would it need to look like before you felt comfortable with, you as a family going to a tournament? Um,
Right. I think, each individual is going to process this a little bit differently. And I think with my background, I'm going to be a little bit more hesitant to get out and about, and certainly to travel to different cities and potentially different states. But I really do rely on information coming out of the CDC and the local health departments. I think it's important to look to them for leadership, because they're really monitoring this more closely than I can, and certainly more closely than everyone at home, relying on different reports from different avenues. So I think that will be my go-to, is going to be focusing on the CDC guidance.
in terms of their training, because they do, both one-on-one lessons with a coach, and then they do the group training. What do you think it will look like going back out on the court, where most families will feel comfortable? And I guess you can only specifically speak to yourself, but do you
Right.
think one-on-ones will come back faster, or will group
I do.
immediately?
Yeah, I think that, and I think as long as everyone is just very honest about their own state of health, the health of their own individual families too. So I think, as long as everybody, we have an overall sense of wellness at an individual level, and then within the community, then we could start, getting out there a little bit more. And I think first would be that the kind of one-on-one individual coaching, maybe with some of the things that Coach Newman put in place in the beginning, with being careful with handling balls, and of course washing hands, and trying to minimize the number involved in small groups. So I think it's going to be kind of a backwards approach, right? So about a month ago, we were still doing clinics, and then adapted that to smaller clinics, and maybe some individual social play with friends, and then one-on-ones were still around, and then all of a sudden we're just at stay at home with our families, working on some individual strategies. So now maybe we'll see that progression in an opposite direction, where we feel comfortable getting out there with a primary coach, then eventually going to maybe some small groups, and then I think relying on the USTA and the CDC to kind of make these bigger picture adjustments, and opening up some doors when it's appropriate.
I find it interesting that you are looking to the CDC for information, and kind of putting it out that it's changing all the time. That what we know about this virus, because it is very new, is constantly. So what we knew a week ago is very different, possibly, than what we know today. Hearing reports of people might be able to get it just through breathing, certainly coughing and things going out.
Right.
The measles is probably the one that I think of as being most infectious, where the measles
You're
can go
exactly
through
right.
air handling systems in buildings and be spread that way. This one seems to be a little more virulent than just the flu. Um,
Right.
what should people do to keep up with whatever the latest information is, which is coming out? Um,
Right.
is it
I think
watch
that's
the
that's
news?
actually been the biggest challenge for me over the past couple of weeks, and it's just sifting through information and data. And it, like you said, it changes every day. So I'm really relying on some of the top health officials within the state of Texas, and then overall the CDC. But the Texas Medical Association, the Austin Public Health Department, those are all very, very good resources. And I think they have information that's geared towards physicians and healthcare providers, and then they have healthcare information that's geared towards just overall families and patients as well. So I think that's a really good resource, but it's challenging. It's confusing for healthcare providers. I mean, we've had to adapt and adapt and adapt and sift through information and make different protocols. Like my protocol 2 days ago is different from my protocol today for my staff. And then also for my patients, we've gone from a full functioning pediatric office to maintaining well visits for newborns and infants who need to be seen and need their vaccinations, and then really tabling everything else to telemedicine. And it's challenging for sure, but we have to continue to do our job as healthcare providers. We forget that kids get sick from other things too. So we're seeing a ton of oak allergies and a ton of asthma and a ton of just simple day-to-day type things, but we still need to address and be that kind of focal point for these families to take care of the kids. And a lot of what we're doing now is just guidance on COVID and coronavirus in general. So answering questions, trying to mitigate false things, trying to lessen fears for families as well. So I mean, I'm proud to be able to serve in that capacity to these families. But it is a challenge because we're learning every day. And I guess the longer that this virus is playing a role, the more we're going to learn about it, and the more we're going to be able to develop medicines that work and have information. So I think the way that my practices medicine is that we're very evidence-based driven. So we're going to analyze the information. We're going to make recommendations based on that data.
So would you say that your healthcare provider, your primary care physician, is a good place to get real information, or would that also, I mean, because everybody's pretty busy, but do you think that that would be a good place to have the filter be?
I think so. I mean, usually your primary care provider is going to be your focal point, right, for your medical home. So I think that's a good place to start with concerns about specific health things. Now, like general questions, I do think you can rely on, the certain websites that are, I think, unbiased and a little bit more guided towards from the CDC and from the Texas Health Department. I think that's a good place to just identify answers for general questions. But if you're truly worried about an individual situation, then your healthcare provider is going to be that main person that you'd like to talk with. And then I think with any virus, you always want to make sure, is this a direct threat to my health currently? Do I need to go to the emergency department? And I think as we're seeing overall throughout the nation, that emergency rooms are overwhelmed right now. So, kind of knowing those red flags of when I need to activate EMS, when I need to go to the emergency room, and then also taking a step back and saying, you know what, I think I'm okay. Let me call my health care provider and kind of talk about, what these red flags may be, and some anticipatory guidance for that.
Early on, I heard advice which kind of said, if you were to if you're feeling sick, and if you were to compare this to if you felt the same way a year ago, if you would have gone to the emergency room, then go to the emergency room. If you wouldn't have gone, then don't. But now I'm hearing that people's condition seems to deteriorate so fast that they go in and they're barely laboring, breathing, and then next 4 hours later they're on a ventilator.
Right.
Would you suggest that people try to get earlier intervention than they may have a year ago, or is that still good advice?
And I think that's the scary part of this virus, and it's the scary unknown. So a lot of the percentages say, most patients have a mild to moderate illness. Most patients can have asymptomatic illness. So it's really kind of knowing when. I think your healthcare provider is going to be that main person to help make that decision for you. If you need to be on the lookout for symptoms that will prompt you to go to the ER a little bit faster. But I think just having that knowledge in general, where you can know that things can happen quickly, then that in itself is a valuable piece of information. Just having the I guess knowledge to know that, hey, I feel okay right now, but chances are I have to make sure that I feel okay tomorrow. And I think that's an important piece where your healthcare provider can help you answer those questions.
Good. Well, thank you for bringing some substance to what it is that many of us are hearing as rumors and what makes sense. We certainly hope that the boys are back on the court with us very, very, very soon. So that's what we're hoping for. But we're also working very hard to make sure that we have in place something that brings significant value to them, in the situation where we're in, and having to do things remotely, virtually, and
Right.
we're
No,
glad
we
that they're
appreciate
enjoying it.
it.
Um,
They
so
are. They look forward to it.
good. Well, thank you so much for being with us. This was Tennis 2020, real talk, real people, real life. Speaking with Dr. Danielle Grant of Beansprout Pediatrics here in Austin, Texas. We'll be back with more great information from great people real soon. Be well, stay safe, wash your hands a lot.